Hi, I'm Gayle Tenenbaum, and I have the greatest job in the world. I get to talk to governors and senators and congressmen and state legislators all about wonderful children, like all these wonderful children sitting here today. Hey kids, I have a question to ask all you kids. If you're happy and you know it, do you know what you're supposed to do? That's right. Why don't we do that? You guys have been sitting here so quiet and so good, so let's do that. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it, then your life will surely show it. If you're happy and you know it, clap your hands. Thanks. We needed that. We needed that. You know, I want to thank everybody that's here, because day in and day out, you all are on the front lines of working with children and with their families, and we applaud you for doing that, and we thank you for doing that. And here we are. I've just been sitting here watching the little ticker tape go around on the dispatch building, talking about the latest polls in the Obama-McCain race. Ohio is it again. One time, folks, we're the epicenter of this race and the battleground for the presidential election. And it's a battleground, and it's also our home. And it's a home where, in the past few years, Governor Ted Strickland and our Ohio lawmakers and our state and federal lawmakers have put aside many of their partisan differences to try and make things better for Ohio's children, from our very smallest children until our children who are finishing college. And I think it's important to talk about some of the good things that have happened here in Ohio for our children. I know you join me in believing Ohio can be a state where families get the consultation and young children get the treatment they need to address mental health issues, where young children aging out of foster care get targeted support with their health care needs so they can pursue their education and independence with peace of mind until they're age 21. And a state where parents living in poverty who go to work every day can have health care and be healthy for their children. This is a vision in which we work, is within our reach if we continue to work together and build on what our Ohio leaders have already started. Despite tough economic times, the governor and our senators and our congressmen and women and our members of the Ohio General Assembly are keeping their promises by investing in programs for our children and their families. They are keeping their promises to make sure that Ohio children have access to health care and they get preventative health care to help control their asthma rather than costly emergency room treatments in after attacks happen. And this is very important. In the last week, you may have noticed that the governor had to ask his departments to cut another $500 million out of the budget because of the economic times we're in. But he held the line items harmless and said there could be no cuts in Medicaid, and there would be no cuts for children's health care. Sure that they keep their promises that mental health services for abused and neglected children are available early when they need them most. They're keeping their promises to parents of autistic child so they get their help for their child through the Help Me Grow program and through specialized screening programs. That more 3- and 4-year-olds can attend high-quality preschool and enter kindergarten ready to learn, and more children have access to full-day kindergarten. They're keeping their promises for support for out-of-school time programs so parents have the peace of mind that their children are in safe and quality learning programs while they work. Hundreds of parents, physicians, child care workers, nurses, and other professionals will get help in dealing with children with behavioral problems. Before Congress adjourns, they're keeping their promise by passing the Fostering Connections to Success and Increasing Adoptions Act, House Bill 6893, that will provide additional supports for adoptive and guardianship families, expand coverage for youth in foster care, and create a kinship care navigator program modeled after Ohio's program. Both Senator Brown and Voinovich are co-sponsors of this bill, as were Congressman Teaberry and the late Stephanie Tubbs Jones. And in fact, one of the parts of this bill are named after Stephanie Tubbs Jones. Our elected officials stepping up for children, putting aside partisan issues. Stepping up for children, putting aside partisan issues. But we still have work to do. We need to continue to work with our policymakers to address the fact that the poorest group of people in Ohio are children under 5 living in single-parent households. That 106 children who are eligible for health care that the legislature and the governor has provided the funding to support are not presently enrolled in the SCHIP program because of a lack of outreach and cumbersome regulations, and that African American children are overrepresented in both our child welfare and in our juvenile justice system. We can continue to build on the good work that has been laid and the foundation that has been laid, but we must do more to address a lot of these issues.